Prince Albert piercings. What you should know before getting it done. Coming up next on Consultations by a Piercer, episode number 52. For those who are new to the channel, welcome to the Body Piercing and Tattooing channel. I hope you enjoy the videos. Hope you find them useful and helpful, but you may not know who I am. My name is DaVo. I'm a professional body piercer and have been since 1994. I own and operate the Axiom Body Piercing Studio, located right here in Des Moines, Iowa, inside Skin Kitchen Tattoo. Before we get into this, I just want to give a little bit of a disclaimer. I'm going to be talking about a penis piercing. If you are easily offended, not of an appropriate age, live in a part of the world where that's not acceptable, then this isn't the video for you. I would really suggest trying one of our other videos. There's plenty of them that have absolutely nothing to do with this particular topic. Now, if you're looking for something that's going to be sexually exciting, you're watching the wrong video. This video is solely designed to be educational for those considering this particular piercing, or maybe the partners of those, or those that are just simply curious and want to learn more. There's nothing sexy about this. Now, just to give you a brief rundown of the location of this piercing. It is done on the underside of the penis, right where the glands kind of swoop downward and above where the majority of the tissue that's left over from the foreskin, or where the foreskin connects, if you still have it. There's kind of creates a triangle. It's done either dead center or a little off to one side or another, depending on if there's a tendon there. Into the urethra and then out the front. Usually the most common piece of jewelry you're going to wear would be a Cathy bead ring or a circular barbell. You can wear curved barbells in this too, but that's the main two. This piercing takes anywhere from 6 to 8 weeks usually to heal. There's a lot of blood in the area, and it's a very thin piece of tissue. However, I generally suggest treating it like a healing piercing for a minimum of 3 months just to be on the safe side, especially if you're sexually active. What that will entail is cleaning twice a day using a sterile saline spray. Personally, I like Neomed's Piercing Aftercare. It's what we stock here in the shop and sell to our clients. However, not everybody has access to that. If you're in one of those parts of the world where you just can't simply find it, any other sterile saline would be fine. You just want to look for a couple things. The first thing being is that it is in a pressurized metal can. The second thing would be that it says sterile on it. It should be in boldface lettering on the front of it. Then when you turn it over and look at the back, it should say under ingredients, water and sodium chloride. There should be nothing else in there. No additives, no preservatives, etc. A common thing people ask me is, well, can I use my contact solution? No, because there's enzymes and other things that are added to that. Can I use my nostril spray? Sometimes the nostril sprays have additional things in it, like antifungis and etc. We don't want to use any of that stuff on your fresh piercing. Now, all the things you don't want to do. Cross-contamination prevention. Common sense things. Wash your hands before you handle it. No oral contact or exchange of bodily fluids on, near, or around the piercing for a minimum of 6 months. That doesn't mean you can't have sex for 6 months. That just means you need to use some type of latex barrier. And we'll get a little bit more into that when we talk about sexual activity later in the video. Keep your environment clean. That includes clothing, bedding, towels, anything that may come in contact with the piercing needs to be cleaned on a regular basis. Do not swim. Do not submerge this piercing in bodies of water that you cannot control the quality of it. I know you're going to get mixed results on this one, so here, let me explain it. It is an open wound until it heals. There is no way you can get a body of water that's large enough for you to submerge your whole body in it and then move around that isn't going to have microorganisms in it. Basically, foreign pathogens. They can work their way into the piercing. They can cause an infection. Now, the other problem with treated pools and etc. is sometimes the chemicals can cause issues also. So, no swimming until it's healed. This one always gives me clients give me an odd look when I say this, but keep pets away from it. Mainly what I'm concerned about is them having access to your bedding. They tend to collect all kinds of microorganisms. They have their own colony growing on them, and then they spread it around your bed. And then the piercing comes in contact with it, and you have an infection. So keep them out of the bed until the piercing's healed. Trauma, clothing, and abuse. Avoid constrictive clothing. Try to find something loose fitting, especially in the first couple weeks. If it hurts to wear something, or it's uncomfortable, or the jewelry's constantly getting caught on something, probably not the best option for the initial healing period. Stabilization of a piercing is always a good idea. Things like boxer briefs and briefs are usually kind of a better option for the first couple weeks. Do not sleep on the piercing. Make sure you're sleeping on your side or your back. Do not spin, rotate, or move the jewelry. This is not a fidget spinner. There is absolutely no reason to move the jewelry. I know at some point in your life, if you've had any piercings, they told you to do that. There's no reason for it, and it's just going to increase the likelihood of issues. Kind of on the same note, do not play with a piercing. Do not mess with it. Avoid contact with the piercing as much as possible. We need to talk a little bit about bleeding, because this piercing does have a reputation to do that 2 to 3 days, sometimes 3 to 5 days after the piercing is done. Usually the larger the gauge the jewelry is pierced at, the more bleeding you're probably going to see. For that reason, I generally suggest wearing a sanitary napkin or pad for that first week, basically. It's going to do a few things. It's going to keep you, avoid you staining your favorite pair of pants. It's also going to kind of add a little bit of cushioning while it's going through its most tender phase. It also cuts down the amount of moisture in the area, which can cut down the amount of bacteria. So it's just for that first week or so, it's a good idea to wear something against the piercing that's going to kind of avoid that possibility. Let's talk about risks. Stretching or thinning of the tissue. Now, this comes into play when we start stretching the jewelry or putting bigger jewelry in and stretching the piercing. This can thin out that distance between where the piercing's at in the urethra. It also increases the width of the urethra, kind of enlarges it, the exit. So these are all possibilities with, as far as risks, with Prince Albert piercings. Then there is STIs. Anybody that has a genital piercing have an increased risk of contracting a STD. It's softer tissue. It can tear easier. You have an exchange of bacteria in blood and everything else, and bodily fluids, and you have something you didn't walk into the room with. It is why it's important anytime you switch partners that you practice safe sex the way you're supposed to, which means some type of barrier to protect yourself. The last one is closure. Any piercing, mainly during that first 6 months, if you take the jewelry out and leave it out for an extended period of time, your body is going to close the piercing. This piercing can kind of become more of a permanent fixture. Usually the more you stretch it, the more likely that's going to be. I've had mine out for weeks on end with no problem putting them back in, but mine stretched out quite a bit. Now let's talk about one of humanity's favorite subjects, sexual activity. Whenever you're ready, gentle at first. If it hurts to do something, stop what you're doing, take a rest, or try something else. One of the biggest issues with this is how that jewelry needs to turn to the side and how much pressure it puts on the piercing. It's not very comfortable for intercourse. As I mentioned before, latex barrier or nitrate barrier for a minimum of 6 months. One thing you do want to consider, or if you can find them, is a larger reservoir condoms. You want to wear a kind of looser fitting. I would stay away from anything that's ribbed or anything like that. Also, if you use any type of lubricant, make sure that it is water-based only with no additives, no heating or numbing or any of this other nonsense. It'll probably cause problems. Also, stay away from things that have spermicide on it. The ribbed and that kind of stuff does not feel comfortable because it smashes that jewelry against the side and it doesn't feel good. You have a little bit of that during intercourse anyway, and kind of using a condom helps with kind of putting it in a position that is comfortable initially, opposed to just kind of trying to put it in there and it moving around a lot. Now let's talk about anatomy and jewelry. The anatomy needs to be, there needs to be enough room for the jewelry. Now, if you're uncut or if you're cut, circumcised, probably not going to be an issue. If you're uncut, then it may be an issue. That jewelry will sit in there underneath your foreskin. So your foreskin needs to be loose enough to allow that jewelry to sit comfortably inside there. If it's too tight, it's going to cause issues like your foreskin not retracting again, or not retracting, going back over the glands, and kind of being stuck, retracted, which can put a lot of pressure on the piercing, kind of force forward, which could lead to migration, rejection, tearing, all kinds of other issues. The other thing is with it is some people have noticed agitation with inside the foreskin when it's sitting. It's best to have something that's kind of loose fitting. Now, as far as the location, there's kind of, like I mentioned earlier, kind of a triangle area that we pierce through. If the florineum tendon, which sits generally right in the middle, especially if you're uncut, is directly in the center, it needs to be pierced to the one side or the other. And the main reasons for this is if you are not circumcised, it could break down your body's ability to recover the glands. If you're circumcised, it's going to hurt a ton. It might cause a situation during the piercing where the needle slides one way or another instead of going straight through where we need it. You miss the needle receiving tube, and then they're damaging the inside of your urethra by doing a needle strike inside there. And that may be a little bit more clear when I explain how we do these. The thing about it is that it probably one way or another, even if you pierce through that tendon, it's going to migrate to one side or the other. Now, as far as choosing the side to do it, we generally suggest the side that you dress to. It's the side that your penis normally lays to, either the right or the left. It's an old tailor term. They would ask you, which side do you, gentlemen, which side do you dress to? And the reason being is when they did your inseam, they would eliminate the possibility of maybe touching you inappropriately. Now, as far as jewelry, either I personally like to pierce with rings or circular barbells. Curved barbells are possible. It's just very difficult to find the proper size, especially in titanium, in most cases for this particular piercing. At least that's been my experience. You usually need something that's at least a 5/8 of an inch or longer for most people. We're all different, but you kind of, when we're doing it, you kind of have to oversize from the standpoint of, that area of their anatomy is probably going to get a little bit larger during certain activities. But the standard has always been the good old-fashioned catty bead ring. Just to give you an idea on the procedure, first thing we're going to do is we're going to disinfect the area with a surgical scrub. Then we're going to mark the piercing. Have you take a look at it, see if it's where you pictured it. Then we're going to go ahead and reglove, of course, put you in a reclined position, insert a needle receiving tube, which is a hollow tube about 2 inches long and not very thick. Line it up with the piercing marking, inject the needle in and through in one smooth motion. Then we go ahead and insert the jewelry and close it up. Aftermath, usually with these, there's not a lot of throbbing and aching. It's usually kind of an, oh, God, that hurts, and then it's over. And then you move on to what I'll generally do is I'll take a clean glove, put a piece of gauze with some saline on it against the area, and then peel off the glove or pull the glove over the area and then tighten it on with a rubber band so that you can kind of get to where you need to go without having to worry about it bleeding. One thing that isn't often mentioned is the first time you urinate, there's probably going to be a big giant blood clot that comes out. That's pretty normal, nothing to freak out about. It's just part of the process. Now let's talk a little bit about alternative jewelry. I'm commonly asked about these questions in comments and emails and etc. So we're going to cover two of them. The first one being the Princess Wand. This was kind of a popular thing, I guess, back in the 90s. You can get these for... you get them where they have a combination of like affidelias and amplings, and you do them with PAs. And what it is a tube roughly about 2 to 3 inches, sometimes 4 inches long, that actually inserts in the urethra, and then you line up the threading with the piercing that you have, and then tighten it on, and it stays in place. Some of these will have a drain plug on the front, etc. Now, the problem with these is that there's very few manufacturers that are actually making these, and most of them seem to be in the sexual novelty business. I really have not seen a major manufacturer in a long time, somebody that I would think produces quality jewelry that actually sells this, especially off the shelf. It's usually a custom piece and very expensive. If you're looking online, you're finding stuff and it's not very expensive and you're a little unsure, chances are it's garbage. It's probably the same stuff you would find at your local adult emporium of seller of toys. So that brings up a lot of questions. The first one being is, what exactly is the material it's made out of? Is it implant grade certified stainless steel or titanium? This is a huge issue for a lot of different reasons. First off, allergic reactions. The second thing is constantly in contact with urine, which would make it prone to corrosion. And if it isn't highly polished in the proper material, you're going to have some problems and possibly some things you never thought of. The other thing is the finish needs to be super smooth because it's going to be inside your urethra, and it's probably going to not feel comfortable at first at all. In fact, it'll probably feel painful. Some people might be familiar with sounding, but if you've never had any experience with that, this is probably not a piece of jewelry you even want to play with. So the biggest thing is finding somebody that's reputable, that actually makes the material out of a biocompatible material and has expertise to do a nice high finish on it, and have no sharp edges or points. This could potentially cause a lot of damage on the inside of your urethra, lead to things like blockage, which is always a problem even with normal ones, is that things could start collecting on the inside the hole and block everything. There's a lot of problems. The main advantage to this for most people, as they've said, is it kind of eliminates one of the things I haven't talked about yet, and that's the urinating thing. The next piece of unusual jewelry is a chastity device. I've seen a couple different types of this. A lot of the same problems. The people that are selling it are not body piercing jewelry manufacturers. What they are is they are novelty sex toy manufacturers. So the materials these are made out of is highly questionable. The other problem is that it's going to put a lot of pressure on the piercing. So unless it's a really thicker gauge and it's fit properly, this could cause some damage to the piercing. Constricting it in a way where it's not supposed to be. The old school theory on this or whatever, of putting extremely large rings in it or getting a gish piercing and connecting the two. I don't advise that stuff either, mainly because the large ring is going to be extremely uncomfortable and get in contact with absolutely everything. The connecting of the two, when you have an erection, causing that pressure is probably going to tear one of the piercings. And that's a problem even with these manufactured chastity devices, is they can really agitate it. They're just not made to a high quality level. Now let's talk about living with a piercing a little bit. This piercing will cause urinating to be a little complicated. Everybody thinks it's because there's a second hole. It has more to do with the jewelry and the urine collecting on the jewelry, and this effect of kind of putting your thumb over a garden hose that causes the stream to kind of go all over the place. Me personally, I've had mine for, about 29 years almost. And if I'm in a clean place, like at home or at the shop or the studio or somebody's house or what have you, I'll usually just sit down to pee. It's just part of my life now, and it has been for a long time. If I'm out in public and there's a urinal, it usually isn't a problem. Sometimes twisting the penis so that the jewelry's at the top will kind of eliminate some of these problems, but it is going to be messy, and you need to understand that standing and peeing is probably not going to be an ongoing thing in your life, and it is something that's affected by this piercing. Now let's talk about what to consider. This piercing is probably going to bleed at least for a couple hours in some cases right after you get it done. Dress accordingly. Wear some clothing that you're not concerned with if it gets stained. Also, it's not a bad idea to prepare ahead of time and bring pads with you or sanitary napkins, just to be on the safe side. This piercing has a tendency to stretch itself. It is not uncommon for you to go from a very thin gauge, maybe 12 gauge, to a very large gauge fairly quickly. Usually in most cases, you don't need a taper or anything. The jewelry will just slide in. However, this is going to continue. And then you start getting into these large gauges and you're dealing with much heavier jewelry, which will cause it to stretch even faster and could cause it also will increase the entrance into the urethra. So do take this into account. Take your time and understand this is just part of this piercing. The next one is you're not going to be able to sleep on this piercing. If you're a stomach sleeper, you might want to consider trying to train yourself to sleep on your side beforehand so that it's not such a big deal right after you get it done. A couple of tricks is snuggling up to a body pillow or sleeping with a pillow between your knees will kind of keep you from tipping completely over. It's just easier, and I'll tell you, sleep is very important in getting well rested and reducing stress in the healing process. So anything you do to get more sleep, it's a good idea. Talk to your partner. This will, in a way, affect their sex life for a while until this piercing is healed. You should always discuss modifications of this nature with your partner beforehand. Get their insight. The bottom line is it's your body to do with what you want to, but if you're in a committed relationship, it is something you should discuss. The other thing is don't do this as some kind of surprise for them. You're not going to want to be very frisky for the first few days after the piercing is done. So it's not a good idea to get this done right before a romantic weekend. If you're going to do that, you want to do it far in advance or do it when you aren't going to be doing things that are of this nature. As a lot of piercings, it's a good idea to do this when you have a few days off from work, like a 3-day weekend. Do it Friday of the 3-day weekend. You have a few days to just kind of chill around the house in loose-fitting, comfy pants and not have to deal with things. Just a good idea. The next one is you cannot swim for at least 3 months. So if you have plans or if swimming is a regular part of your life or you compete or what have you, make sure you're doing this during a period of time where you're not going to be swimming. And the last one, are you going on vacation or some type of trip? The problem with vacation is you never understand or never know how clean the environment's going to be that you're going to get stuck in. You have no control over it. Oftentimes you're in an environment that you've never been exposed to, so you might be exposed to pathogens you have no immunity for, and it's a hassle to stop everything you're doing and all the fun times and clean it. The other thing is you're probably going to want to swim, and you can't do that until it's healed. So wait till after the vacation or do it far in advance of the vacation to make sure that you can have a good time and relax and do what you're supposed to do on vacation. Well, that's it. Do you have a PA? Do you have a Prince Albert? What was your experience like? Do you have any hints? Make a comment. Till next time, here's hoping your piercing seal of ease without a single issue. And if you are in the Des Moines, Iowa area, I would love to see your piercing needs in the future. Have a good day, everybody. Take care, and check out this next video.